Hey, welcome everyone. This is Dr. Garen Weiberg. I'm a doctor of physical therapy and board certified sports specialist, and this video is about knee pain. So I just got off of a consult call with a professional strongman and powerlifter who developed knee pain about 2 weeks ago, and we just had a really good conversation. He was super appreciative afterward and said that was really helpful. So I said, hey, I've been making these YouTube videos. I think I'll share this and hopefully it will help somebody else. So make sure you stick around till the end so you can kind of hear the advice I give them and also find out how you can get a free kind of a mind map or decision-making tree of all of the key points that we talked about today. So I'm going to break down his case kind of item by item and explain to you what I was thinking as he was telling me these things, so you can kind of get inside my mind and figure out how I kind of sift through the details of the diagnosis. All right, so here's the case. We have a 32-year-old male who's a professional strongman and powerlifter. He was doing some sprint work about 2 weeks ago and developed pain and swelling in his knee later that night and into the next day. So nothing happened during the sprint, and he actually felt okay during and immediately after, but he noticed the swelling come on and the pain come on later. And then the pain kind of the swelling kind of started to gather in the back of his knee, and he kind of describes it as like a mass or a lump behind his knee that's uncomfortable when he goes to bend his knee. So not like sharp pain or anything, but he just says there kind of feels like there's pressure behind his knee when he's trying to bring his heel to his butt. Overall, he's getting better. It's been 2 weeks. He can work out, squat, lift. He just can't run. And if he tries to run, his pain's about a 4 out of 10, but it pretty much goes right away. It doesn't affect what he's doing the rest of the day. Like I said, he can go on and lift, he can go up and down stairs, he can bend, he's getting better overall. So yeah, he wants to know what's going on and does he need to go see somebody about it. All right, so should he go see a doctor, physician, an orthopod, get an x-ray, an MRI? I actually told him no, and here's why. Regardless of the diagnosis, let's just look at kind of the facts of his case and how he's presenting. He's getting better overall. He has relatively low pain. So obviously everybody's pain is different, pain's subjective. My 4 is different than your 4, which is different than his 4. But relatively speaking, we classify kind of 0 to 4 as low pain. And irritability. So irritability lets us know kind of how angry or acute the injury might be and how much he can tolerate. So he can lift, right? He can squat, he can do all these things. He just can't run. But even when he runs, it only hurts while running. And then when he stops, it's not like it's flared up or angry later. It doesn't stop him from doing anything. He can lift that night. He can strength train. He can, kind of do whatever. So pain's relatively low. Irritability's low. So I know whatever, again, regardless of the diagnosis, whatever tissue that he injured, damaged, irritated, it's not all that angry right now. And overall, he's not that worried about it. So he's not like, man, I'm really concerned. I'd like to get, an x-ray. I think I did something. He's not that worried about it. He's like, yeah, it's getting better. I kind of want to know what's going on, but it's not really affecting me. Then, there's no really medical red flags in this case. Things that stand out as peculiar or, going on with him overall that concerns me. So for him to go see a doctor, I just think it's going to be a waste of his time, money, and energy. They're likely just going to tell him to rest, take some anti-inflammatories. They're going to do an x-ray. They're not going to do an MRI at this point. Most insurance companies make you kind of fail physical therapy, meaning you have to go to physical therapy, not get better, then they'll approve the MRI. So if I don't think he needs to go to see the physician, ortho, when does somebody need to go to see the physician, ortho? Well, kind of the exact opposite case here. So somebody whose pain's getting much worse, the pain's really high, it's really irritable, it's affecting their life. Now they can't, go up and down stairs, walk, bend. It's just getting worse and they're really concerned about it. Absolutely. I'm like, yeah, let's go get it checked out. But in his case, it doesn't fit that pattern, right? And then there's something called the audible knee rules, which is a validated set of rules to determine who actually needs an x-ray so that we can better predict, who might have a fracture and who's going to receive an unnecessary x-ray. So the audible knee rules are, if you're 55 or over, you have tenderness to the head of the fibula, isolated tenderness to the patella, inability to flex the knee or bend the knee to 90 degrees, and inability to bear weight immediately after the injury. He has none of these. So I do not think that he needs to go to the doctor. They're probably going to do an x-ray anyways because, yeah, he did have pain and swelling. But based on the audible knee rules, which are validated and sensitive, he doesn't need an x-ray. So, no, I don't think he needs to go to the doctor. Like I said, I think it's going to be a waste of his time and money. All right, so what is it or what could it be? I mean, he did something right. He had a clear sign of inflammation. He had pain and swelling. So he definitely injured something. So I think in this case, the behavior of the swelling is key. So swelling that presents hours after the injury and encompasses the whole knee and then gathers in the back of the knee makes me think that this is a Baker cyst and that he did damage or irritated to something within the knee joint. So what a Baker cyst is it's a collection of fluid behind the knee in that knee pit, and it is almost always because of damage or irritation within the knee joint. So things like the meniscus, the cartilage over the bone, the ACL, the PCL. So he described this kind of this swelling throughout his whole knee that then eventually gathered into like a mass or a lump behind his knee. And that sounds to me to be a lot like a Baker cyst. Immediately I'm thinking, okay, and he was running, so a lot of impact there. He did something to his meniscus, the cartilage in his knee, bone bruise, less likely. Typically, if you're getting to the point of damaging the cartilage or a bone bruise, this is going to be a high velocity mechanism that, has to tear something. But this is just going on. This is what's going on in my mind as he's saying these things. And I'm trying to rule up and rule down different diagnoses and what I think it could be based on what he's saying. And right now, what's a little interesting but is insightful is that he's having pain with impact, right? He can squat and lift, but it's just with impact. So it makes me feel like it's something with that shock absorption. And the meniscus is the shock absorber between the two bones in the knee. And again, the way the swelling is behaving, in the potential Baker cyst in this case means that something had to have happened within the knee joint itself. So you can't have, I guess you never say never in medicine, the body's crazy, right? But it would be very rare for you to do something to your kneecap or your patella tendon or something like that and have his swelling response and the swelling kind of gather in the back of his knee. So let's look at, if I'm thinking it's kind of a meniscus or intra-articular, meaning inside of the knee joint type of injury here, let's look at something called the Meniscal composite score. So it's kind of a set of 5 findings that are very specific in ruling in the diagnosis of meniscus injury of some sort, okay? So, and this has actually been updated. There's a newer version that includes a few more things, but I kind of like this chart here, and I use this every day. And like I said, it's very specific. So it's a history of mechanical catching or locking reported by the patient. He is not reporting that. He basically has full knee range of motion. He can fully extend his knee or straighten it, and he can bend it almost all the way. And I'll talk a little more about that, right? So then joint line tenderness. So joint line tenderness is the line between the femur and the tibia where the knee bones come together. That's where the meniscus sits. Does he have tenderness along that joint line? Pain with forced hyperextension, meaning if he locks his knee out, really tries to extend it, push on it, crank it in that direction, does it hurt? It does not for him. Pain with maximum flexion. So this is where, you kind of got to use some clinical reasoning and your expertise and your intuition and your experience with this. So when he bends his knee, he's describing kind of pressure behind his knee and discomfort, but he's not describing a sharp pain or a block to motion. So a lot of times with meniscus tears, depending on the size of the tear and the location of the tear, the meniscus itself can actually flip up in the joint or get in the way, and their knee will literally lock. They can't bend it past a certain point, or it actually gets stuck. He's not describing anything like that. Now that in and of itself doesn't rule out a meniscus tear, but what he's describing just sounds more like pressure behind his knee, and I think that's just because of the swelling, not necessarily a positive finding in this meniscal composite score. And then it says pain or audible click with this McMurray's test. McMurray's test is a special test to diagnose a meniscus tear. Obviously, I can't do that on him. He can't do that himself, but I did have him do a different test that he could do himself. That's kind of a twisting test. It's called Thessaly through his knee, and that did not bother him. So, a little, not straightforward here. I mean, again, he clearly had damage to his joint, pain and swelling response, but he really doesn't have any of these positive findings with this meniscal composite score. In 0 positive findings, I mean, the sensitivity and specificity on that, the specificity on that is very, very low. So the likelihood of him having a meniscus tear is very low. Maybe he has 1 out of 5, but again, that pain with the forced flexion or bending, in my experience from all the meniscus tears that I've seen, it doesn't sound like that. It just sounds like he has pain and pressure behind his knee. All right, so what are some other things that it could be? So we have the potential of bursitis here. So there's 4 burses behind the knee, kind of in a quadrant pattern, top left, top right, bottom right. So I asked him right off the bat, where is that kind of mass, that lump, that collection of fluid? He says it's right in the middle of his knee. The other thing about bursitis is an inflamed bursa can absolutely create like a lump or a mass or a ball, but it's extremely painful. Any acute bursitis I've seen is very, very painful to touch. So I'm having him, poke the back of his knee, move that swelling and mass around. It's completely pain-free. And again, it just kind of feels like this soft ball of fluid, which isn't exactly, so that's not consistent with bursitis. So that rules down my diagnosis of bursitis. What else could it be? So it could be local muscle and tendon, the hamstring tendons attached behind the knee, the calf tendons attached behind the knee. You have some little muscles in the back of the knee like the popliteus. It could be. The way the swelling behaved, though, again, kind of going throughout the whole knee joint and then collecting in the back, makes me feel like it's less likely just a local muscle issue. And he's lifting, like he's doing isolated hamstring exercises, he's lifting heavy weight. I would expect that to bother his knee if it was contractile, if it was muscle, and it's not. So what else could it be? Again, the way the swelling's behaving, it tells me that it's something from inside the knee joint. That's what the research would say. That's what all the text would say about the way the swelling is behaving. So what else is inside the knee joint? Could it be his ACL, his PCL, articular cartilage, meniscus, right? All those things, I guess, are a possibility. But for the ACL, PCL thing, he has full motion. He's not reporting instability, like his knee's not giving out on him. Again, it's getting better overall. And also, ACLs are torn in a very specific mechanism of injury. Thank you, Dr. Timothy Hewitt. We know exactly how ACLs tear. This guy did not have a specific mechanism of injury. And that reminds me, I kind of forgot something about the meniscus thing here. When he was running, it's not like he had this instant where he stepped wrong, twisted through his knee, felt a pop, felt a tearing sensation. So it's hard to kind of tear a meniscus and an ACL. It happens for sure without kind of this specific mechanism of injury where I just did something, okay? That did not happen in this case. So there's some other possibilities. Is it arthritis? He's 32 years old. Probably not. He didn't have a past knee surgery. He's not reporting joint stiffness. I asked them, I'm like, is your knee generally, kind of stiff and achy in the morning? Does it ever swell on you if you do too much? None of that stuff. So probably not osteoarthritis. I mentioned medical red flags earlier, very rare things like, bone cancer, blood clots. Doesn't fit the picture at all here. Some red flags in general, just good information to know. High levels of pain that are constant in nature, meaning they never change with position or activity, pain at night, unexplained weight loss, generally feeling like crap, and just that gut feeling that you feel like there's something else going on here. He doesn't have any of that. Young, healthy, strong dude. Okay, so, not 100% clear what's going on with his knee. We know he doesn't need to go see the doctor, doesn't need an x-ray, he's not going to get an MRI, it's getting better. We kind of know what it is. I know it's something from inside of his knee joint. It's behaving like a Baker's cyst, which tells me meniscus, cartilage, bone, something within the knee joint. So what advice did I give him? Sorry guys, nothing groundbreaking here. Compression and elevation for the swelling. Maybe consider wearing a knee sleeve to manage the swelling if it's swelling after activity. Although I told him if it is swelling after activity, wow, that was tough to get through. If he's swelling after activity, then he's probably doing a little too much. So he's going to need to modify. But yeah, handle the pain, manage the pain and swelling, wear a knee sleeve if possible. Get the motion back in the knee. So he's having a little difficulty bending it. I said, work on bending it, but don't aggravate it, right? Just a tolerance. That's just maybe a 1, 2, or 3 out of 10 pain, but not pushing into any more than that. And it should linger afterwards. So kind of just working on getting that bend back in his knee and to stay as active and strong as possible. I think in situations like this, when the patient is getting better, they're young, strong, and healthy. They don't have any bad signs going on here. Their pain level is really low. Their irritability is really low. I hate to see when they get shut down from their activities. I think it's just a kind of a negative downward spiral effect, and I like to try to keep people as active as possible as long as it's not increasing their pain beyond a certain threshold or they're swelling too much. So that was basically my advice to him. So what do I think it is overall? To be honest with you, I don't know. And I'm not going to lose sleep over it, and I don't think you guys should too. Because, one, he doesn't need imaging. Even if he got an image doesn't tell you how to treat it. It's not the whole story. It's just a piece of the puzzle. And what we should be doing, and what I feel good clinicians and doctors do, is make decisions based on things like pain severity, irritability, swelling, loss of motion, loss of strength, loss of function, which in this case, I've already said, he is getting better. He doesn't have any bad signs right now. So I'm not going to agonize over what the pathoanatomical diagnosis is. What is that specific tissue inside his knee that may or may not have been, irritated? This is a big guy. I think he's 240 pounds. He's a strong man. He's doing sprint work, right? I think he probably just maybe over-compressed, or it was too much pounding on the joint. It's possible he has this small meniscus tear. I don't think that's what's going on here. I just think maybe from all the pounding from the sprinting, like I say, he's a big guy, created some inflammation inside the joint, and it collected as swelling in the back of the knee, i.e. A Baker's cyst. I don't know for sure, right? But overall, he's getting better. He has all the signs that he's going to continue to get better. I'm going to check back in with him. And I can almost guarantee in a couple weeks, he's 90 to 95% better. If he's not, we'll take the appropriate steps from there. I'll update you guys and let you know if we found anything more out. And we'll go from there. So I hope you found this video helpful. So if you did, please like, share, subscribe, pass it on to somebody else who might benefit from it. And continue to check back. I'm posting videos regularly. Thank you for watching. Take care.